Rusty, we are here in this incredible facility.
This is University of Idaho's D.A. Huckabee Medical Education Building.
So tell us about what this office does.
I like to tell people our office has four main jobs. The first is to support medical education and training, so we provide the research methods training for our students. We need to serve as a data and research hub for the state to answer questions that we don't have the answers for, to gather the data our state needs to improve healthcare for Idahoans. We also need to then serve as an education resource. And so how we do that is we have educational training that spans preparing students to go into health professions programs, to being trained while they are here in different health professions programs, and then doing that after they are licensed and out practicing, so we can have all of them practicing at the top of their license, making sure that Idahoans, whether they be in Boise or a rural town, are getting the best health care possible. And then we make sure that we can accredit those educational programs, whether they are provided by us or our collaborative partners across the state with our Office of Continuing Medical Education.
And how do you provide those resources and collaboration?
We do it with a great team. We have a team of trained researchers that allow us to conduct the research in-house if needed, using a variety of different methodologies. We have faculty who are really talented at what they do and have great expertises. For example, Dr. Bethany Fahrenkamp. So she is studying the development of the immune system, how that benefits infants and mothers, and she's able to bring that cutting-edge knowledge immediately from her lab to the classroom. So our students get the standard information you'd expect in medical school, as well as the latest information that they get from a researcher, and those that are interested in any of those areas have the opportunity to then work with Dr. Fahrenkamp in a research lab and get that training in the first and second years of medical school, which is rather rare, and that really makes our program a unique gem in the state of Idaho. We can work on grant projects, whether that be within the state or in regional partnership, to allow us to bring those grant dollars in and answer the important research questions that Idahoans need. And we do that with outreach education. So North Idaho AHEC, our Area Health Education Center, offers one of those opportunities. They prepare students at the K-12 level. They do health professions training when students are already in a health profession program, designed to teach them how to work in interprofessional healthcare teams in rural environments. And we do that with post-professional training. That might be done by North Idaho AHEC, but it's also done by our ECHO Idaho program, which provides free online training across the state of Idaho, across a variety of disciplines, so that Idahoans in Riggins or Idahoans in Boise are getting the best care possible. And the beauty of ECHO is it's such a good mechanism that it can expand. This past year we've expanded it into the K-12 system, so now we're doing health professions and health training in the K-12 system, and that will expand to educators this year.
Okay, so you guys do a lot.
We try.
Yes. And you had mentioned research though, so what type of research are you doing right now?
We do a variety of research projects. We have projects that we're doing with students here in the medical school, with other researchers on campus, but maybe what I'm most proud of is how we collaborate with other partners in Idaho. For example, we partnered with the Department of Health and Welfare to look at our substance use disorder challenges in the state. What are the barriers for providers to prescribe the medications they need to in order to treat substance use disorder? How do we get them to do that in the most evidence-based way possible? And then how do we build toolkits that will allow people to continue to practice at that level so that Idahoans can get the care they need in any community? Another example would be a partnership with the University of Washington, and specifically Dr. Chris Longenecker. It's called the Rural ProCare Network, and we're studying congestive heart failure care in Idaho. And the idea is, how do we leverage what we've learned in other rural environments, or what we've learned from global health initiatives, to take technology and bring it to Idaho and allow us to bring that new level of care, the use of technology, into these communities, so that the best available care is found anywhere in the state of Idaho, and the geographic limitations of where you are living are not limiting your ability to get the care you deserve.
What you offer here in this office is not only incredibly important to the students that come here and then turn out, but you are strengthening our state in the healthcare that's provided to those who live here, to our residents. That's incredible. Where can our viewers go so they can learn more about what you provide, but also some of the programs like you'd mentioned, ECHO as well?
So if they go to our University of Idaho website, they can work their way to the WWAMI Medical Education website, and they will find the Idaho Office of Rural Medical Research on that website. We have links on the webpage that will take them to ECHO Idaho, so they can see all the training programs that are provided for free in the upcoming schedules. They can learn more about North Idaho AHEC in the Office of CME, and they can also find a list of our publications and our reports that are provided. And if the reports and articles are not freely accessible, they can contact our office and we can provide them for them.
Wonderful. Rusty, thank you so much.
Well, thank you.